Good morning. I'm delighted to be here, and I want to thank Shariki and the Roundtable in general and all the organizers for inviting me to participate. I'm delighted to be here. I'm going to be showing a lot of data. I try to synthesize it down to a manageable amount, but I guess I'm going to start off with my conclusion that disparities in obesity are complex. They're not always what you might imagine because people have a lot of stereotypes about obesity. And I'm going to start with definitions. I know that this group knows the definitions, but for the benefit of all the folks who are participating today, we want to make sure we're on the same page. We use BMI, weight in kilograms over height in meters squared to determine obesity in adults. There are 3 cut points there are more than that too, but the ones that I'm going to really talk about here, overweight is a BMI between 25 and 30. Obesity is at or above 30, and severe obesity is at or above 40. In children, obesity is determined based on a comparison to a reference population. In the United States, we use the CDC growth charts. You can see the line for the 95th percentile at or above that percentile. It's considered to have obesity. Overweight is between the 85th and the 95th percentiles. And I drew in a kind of funny little line that isn't exact, but just to give you a sense that 120% of the 95th percentile is how we determine severe obesity. And that's just a parallel line to the 95th percentile that's higher up. This is just me drawing it in. It's not accurate there in terms of the exact values. Okay, what about data? I'm going to use 3 data sources to describe disparities in obesity prevalence. 2 of them are self-reported data, the National Health Interview Survey and the Behavioral Risk Factor Surveillance System. In the NHIS, or the National Health Interview Survey, it's an in-person interview so that people report their weight and height to an actual interviewer in person. About 87,000 people per year are interviewed. And the Behavioral Risk Factor Surveillance System is a telephone interview, and it's over 400,000 interviews per year. The NHANES is the other survey I'm going to be reporting from, and that's where most of the slides that I'm going to show you. That's the National Health and Nutrition Examination Survey. It's nationally representative, as are the other 2. But unlike the other 2, the NHANES has examination data. And unlike the other 2, the sample size is much smaller. It's 10,000 people approximately for each 2-year cycle. And the data are released after each 2 years. The NHANES has standardized measurements of weight and height, where measurements of weight and height go automatically from the scale and the stadiometer into the database, but the stadiometer actually doesn't always work. Not everybody actually fits on it. So these examinations are conducted in mobile examination centers called MECs, and you see pictures here of the mobile exam centers. Why is it important to mention that the 2 surveys that I mentioned at the beginning are self-report and NHANES is measured? Well, because measuring is more accurate than self-report. And that's because people tend to misreport. They overreport their height most of the time and underreport their weight. And men particularly like to overreport their height. So you can see here, this is the prevalence, most recent prevalence of obesity from 2 surveys, from NHANES measured and from the Behavioral Risk Factor Surveillance System self-report. And you can see it's about 40% based on measured data compared to about 31% based on self-report. So you really do have a big difference depending on whether you're measuring or asking. Before I get into all the disparities, I want to give a little bit of context of, well, what's the big picture of obesity in the U.S.? You all know that obesity has been increasing and that we're heavier than we used to be. But this shows you that in today, or 2011-14 to be specific, And the average man is 29 pounds heavier than they were in the 1960s. And that's just to give you a flavor of how much weight we've put on. Over the last decade, there's been an increase in obesity prevalence in adults from about 34% to about 40%. Among youth, however, 2 to 19 years of age, there's been no significant change in obesity, and about 18.5% have obesity. This translates into 13.7 million youth and 93.3 million adults with obesity. And I was showing these slides to someone just to check, make sure I didn't have any typos, and they're like, wow, that's like a third of the population when you look at, because this person really actually was more in politics and understood about demographics and was surprised about the numbers. All right, now we're going to turn to disparities, what my real charge was. I picked kind of 5, after talking with the planning committee, 5 areas to show data: race, Hispanic origin, income, education, geography, and urban-rural differences. So we'll start with race, Hispanic origin. There are differences or disparities by race in adults. There's a lower prevalence in whites and Asians. These are self-reported numbers from 2017. And you can see that for whites, it's about 30%. And Black, African American, American Indian, Native Hawaiian, and 2 or more races, all it's 37 to 39 to 40%, and Asian about 12%. So you see some differences there. But in particular, the big differences here are white and Asian. There are also differences by Hispanic origin. If you look at overall Hispanic or Latino, it's about 33%. Compared to 30% for non-Hispanic or non-Latino. This is, again, self-reported data. So these are underestimates of what the true prevalence is. Now I'm going to turn to showing you data based on measures, so the numbers, the estimates are higher. I showed you the overall patterns of disparities, but what you really see is when you start to look at the disparities by gender, in men and women, you actually see different patterns. And so here are men and women, Hispanics, non-Hispanic Asians, non-Hispanic Blacks, and non-Hispanic whites. And just to point out one difference here, where in men you really see no difference in prevalence between Black and white men, but you see a big difference in women. So that the pattern is very different. And so when you think about disparities, you've got to think, I think, much more granularly than often people do. And also note the lower prevalence in Asians, which you saw before in the earlier slide. You also have differences by race, Hispanic origin in youth, but the patterns are slightly different than what we see in adults. And one thing I wanted to point out was, if you go back here, notice the difference between whites and Asians, 38% compared to 10%. If you look here now in youth, you've got about 15% in whites and about 12% in Asians, in boys. And that's not statistically different from each other. So you really see a different pattern in youth than you see in adults. And then, of course, the groups themselves are very heterogeneous. And if we look at Asians in particular, this is looking at youth 2 to 19 years of age with the NHANES data. So it's measured data. And in this case, it's overweight obesity. It's looking at the 85th percentile and above, not just the 95th percentile and above. And if you look at different groups, Southeast Asian, South Asian, Filipino, Japanese, Korean, and Chinese, you see big differences. For example, if you look at Southeast Asian boys, it's about 31% compared to Chinese boys, it's about 13%. So you have big differences even within that heterogeneous group of Asians. And also note differences by gender, where among Japanese, Koreans, just as an example, 27% among boys compared to 7% among girls. So there's a lot of differences There's just a lot of numbers, but a lot of differences. Understanding some of these differences that we see by race ethnicity, I think you have to understand some of the limitations of BMI. And BMI, as you remember, is a measure of body mass. It's not a measure of body fat directly. So disparities based on BMI may not translate to actual disparities based on adiposity. And if you look at this graph, these data are old now. They're from 1999 and 2004. But if you look at, this is girls 8 to 19 years of age. And on your left, there's the prevalence of obesity based on BMI. And you see non-Hispanic Black girls, there's a higher prevalence. But if you actually look at body fat measured by DEXA, so adiposity, true adiposity, you don't have differences in body fat in the three groups. So these are our measured data. And then disparities based on BMI may not translate to the same disparities in mortality risk. And this is looking at a publication that looked at mortality risk or increased risk of premature mortality among Taiwanese adults and U.S. adults. And the reference population here is the normal weight, which is 18.5 to 24.9 BMI. And if you look at the overweight category, you see increased risk for the population in Taiwan compared to a slight decreased risk for the US population. What about income? Just to make sure everybody is on the same page on income, the median income in the United States in 2017 was about $61,000. For the poverty level for a family of four is about $25,000, and about 11% of adults and 17.5% of youth live below the poverty line. The top 20%, that cut point is about 126 or 127,000, just to give you a sense of what the income levels are. Overall, obesity is lower among adults with a family income of greater than or equal to 100,000, and this is based on self-reported data. But you can see really very little difference in the other groups, in the four other groups. And remember, I just showed you that 20%, only 20% of the population is above 125,000. So most of the population is below that. Now, if we look at measured data for Menhanes, similar to race Hispanic origin differences, you have differences by gender. You have differences between men and women. And so here I've got 3 cut points of income. Sorry, it's very crude, but Menhanes is a small sample. So we have got 130% of the poverty line, 130 to 350% of the poverty line, and greater than 350% of the poverty line. And you have a big difference between men and women. You really don't have any differences in men, whereas you have this gradient decreasing prevalence among women as income increases. What about when you look at it even more granularly by race of Hispanic origin? So here's, instead of showing a whole lot of graphs with a whole lot of numbers, I tried to synthesize it down. So if you look at patterns by income, they vary by race Hispanic origin. And income increases. I've got men, little arrows on in red there, and women in blue for non-Hispanic whites, non-Hispanics blacks, non-Hispanic Asian, and Hispanics. And you can see that among men, none of those groups do you see a decrease with income when you look at the 3 income groups. And in fact, among non-Hispanic black men, it was actually an increasing pattern with income. Among women, however, you see more of that decrease that we associate with with the disparity. Among non-Hispanic white, Asian, and Hispanic women, there was a decreasing pattern as income increases. The same can be said about youth. If you look at how the patterns as income increases, now you see actually in boys that there is a decreasing pattern in a couple of the groups. But you still see that when you look at boys and girls and you look at the 4 different race ethnic groups, you still see 3 of them where there was no difference in obesity prevalence by income. The disparity by income is widening among girls. This is one area where it is widening, so that if you look in 1999-2000, it was about 5.6 percentage point difference, and now it's close to 12. What about education? Just to give you a sense again of the data behind this, we know that about 88% of the U.S. population has a high school diploma or higher, and about a third is a college graduate. Overall, obesity is lower among college graduates, and this is self-reported data. If we look at, again, differences between men and women and by race ethnicity, we see the same pattern actually in men and women, unlike what we saw in income, where we see a lower prevalence among college graduates for both men and women. And you see the same pattern for all youth, for non-Hispanic white men and women, for non-Hispanic black women, and for Hispanic women. You see that same pattern where the prevalence is lower among college graduates. So it's a little bit more consistent pattern by education than it is by income. You see, just as you see that widening gap by income in girls, you see a widening gap by education in girls. So from about 6 percentage point difference to 14 percentage point more recently. You don't see that widening gap in the other groups. What about geography? I just wanted to show one slide on geography. I'm sure you've all seen the map with the behavioral risk factor surveillance system showing a higher prevalence of obesity, a self-reported obesity in the South. And then urban-rural differences. I'm using the National Center for Health Statistics urban-rural classification scheme for counties, large MSA, medium or small MSA, and rural. Because of small sample sizes in Haynes, I had to collapse those 6 categories. Obesity is higher in rural areas than in large urban areas for both men and women. When you look at severe obesity, you can actually see that among men, it's more than double in rural areas than it is in urban areas. And severe obesity has tripled in rural men between 2001 and 2016, from 2.8 to 9.9%. You see no difference early on between urban and rural men in severe obesity. Now there's a large disparity. There's also a higher prevalence of severe obesity among youth in rural areas, almost double what it is in the urban areas. But there's no significant trends in youth between 2001 and 2016. In the urban areas, in the rural area, when you look at obesity or severe obesity, there's no significant trends. So kind of summing up again, I've shown you a lot of data and tried to synthesize it a little bit, but disparities are complex, as I said at the beginning. They vary by sex, age, and race, Hispanic origin. BMI is an imperfect measure in distinguishing body fat and risk for some groups. Generally, there's lower prevalence among people with family income above 100,000, but that really striking decrease with income is particularly strong in white women. Generally, college graduates have lower prevalence, and children in households headed by college graduates. There's a higher prevalence in rural areas. And you do see increasing disparities in some groups. In particular, you see it among men in urban-rural areas. You see this increasing disparity. I showed you the severe obesity difference, and by income and education in girls. Thank you very much.